We're going to turn to a health alert. Michigan officials have detected the first probable monkeypox case here in Michigan. Preliminary testing turned up a presumptive positive result for an Oakland County resident. According to the CDC, there are 306 confirmed cases in 27 states, including Washington, D.C. The White House now working to secure thousands of vaccines. Our chief health editor, Dr. Partha Nandi, joining us now with more. And Dr. Nandi, what details are being released regarding this case and the big risk of how it affects the public?
Yeah, a lot of people are asking me this question. Very few details have been released, Glenda, to protect the patient's privacy, but the person's reportedly isolating and close contacts are being notified, as they should. As to the risk, the Michigan Department of Health and Human Services says this individual does not, I repeat, does not pose a threat to the public. But I can understand the concerns, right, as case counts have continued to grow in the U.S., and we've talked about this. As of yesterday, 306 cases in 27 states and the District of Columbia have been identified. Despite the growing numbers, health experts, including myself, believe that most of these cases have been spread through sexual contact, and the people most at risk are men who engage in sexual activity with other men, as possible healthcare workers who treat these cases if they don't wear protective equipment. That's because the viral illness can actually spread through direct contact with the infectious rash, scabs, bodily fluids, or prolonged face-to-face contact.
So what symptoms should people watch out for, Doc? Where do things stand with vaccines and treatments?
Yeah, first of all, symptoms, right? What do we watch out for? Fever, headache, body aches, chills, and exhaustion. Kind of vague, but still, if you have any of those and you have any questions, seek out some help. And some people develop a rash on the face, hands, and other parts of the body that look like pimple or blisters. Now, regarding treatments, as you asked, Tecovirimat is an antiviral that's approved for smallpox, but could be also prescribed for monkeypox. However, it's typically only given to those at high risk for getting severely ill, like patients with weakened immune systems. As for vaccines, there is a 2-dose vaccine called Geneo that can prevent monkeypox. It's approved for adults 18 and up, and there's also an older smallpox vaccine called ACAM 2000 that can be used. Now, smallpox and monkeypox are genetically similar, so drugs and vaccines developed to protect against smallpox, while they can also be used for monkeypox. The only issue with the smallpox vaccine, Glenda, is that it has a greater risk of side effects and is not recommended for people with HIV. Now, if you feel like you should get vaccinated against monkeypox, the CDC is currently only recommending vaccines for certain people, like those who have had a close contact with people with monkeypox, may have been exposed to the virus, may have an increased risk for being exposed to virus, like those who diagnosed monkeypox through laboratory testing. And lastly, if you're concerned about monkeypox or feel like you've been exposed, please talk to your family doctor. Again, the risk to the general public is low, but health officials are taking steps to get ahead of this outbreak. For example, testing is being expanded and more vaccines are being offered. We'll stay ahead of this, but also folks who, men who've had sex with other men, we're talking about could those folks actually also get vaccinated? We'll keep you updated on that. Right now, it's not recommended, but close contact, people that are together and at high risk, may also be some people that may need the vaccine. As soon as we get information about that, we'll let you know.
All right, Dr. Nandi, thank you for updating us.
Oh, my pleasure.
And if you have a question or health concern for the good doctor, you can email him at drnandi@askdrnandi.com, or you can send it to us on Facebook or Twitter, and we'll get it right to him.